You're listening to the Monday Night Community Show with Daniel on BRFM.
This is the Daniel Monday Night Community Show on demand through YouTube. Thank you very much for choosing to listen to us through this method. If you'd like to keep up to date with when I add new interviews, then subscribe to this channel. So we're next going to be talking to Dr. Adrian Hall. It's all part of the regular slot I do with the NHS Swale Clinical Commissioning Group. Firstly, Adrian, thank you very much for joining us.
Thank you, Daniel.
Well, I was hoping you could give our listeners a little bit of an introduction about yourself before we go on to our subject.
Right. I'm Adrian Hall. I practice in a GP surgery in East Street in Sittingbourne. I've lived in the area for 25 years now. I first joined the surgery in July the 29th, 1989. So I've just had my 25th anniversary of looking after the people in Swale.
Now, our subject is all going to be about the sun and sunburn, and I think we're going to sort of talk about how seriously we should take the sun, really, and go from there.
Well, I think everybody should enjoy the sun, and the sun, I don't want to convey over the radio that people should keep themselves out of the sun. Don't shun the sun. The sun is good for you. It helps make vitamin D, and so please don't shy away from the sun. But if you are going to expose yourself to the sun, do it safely, and above all, try not to burn yourself.
So do you have any tips for us regarding that?
Right, well, yes. Before I moved to Sittingbourne, I was travelled extensively and worked and lived in Australia and New Zealand. Now, in Australia, that's mainly fair-skinned people living in a very hot climate, and so they are very aware of the risk of skin cancer and sun damage. So in the 80s and 90s, I think it was, they had a very successful, iconic public health promotion with a campaign called Slip, Slop, Slap. And it was introduced by a dancing seagull called Sid. And the Slip, Slop, Slap stands for slip on a shirt, slop on some sunscreen, and slap on a hat. And this ran for about 10 years down under, and was very successful in reducing the incidence of various types of skin cancers in Australia. So my advice to anybody, and certainly with the weather we've been having around Sittingbourne and Swale recently, is enjoy the sun, go out in the sun, but don't burn. And you don't burn by keeping in the shade, slipping on a shirt, and putting on some sunscreen.
I suppose you also have to watch even on a cloudy day or two recently. You still have to be careful. Yeah,
the risks are less on a cloudy day, but it is still possible to burn on a cloudy day. And if anything, try and keep out of the sun in the hottest part of the day. I would say from about 11 in the morning to about 3 in the afternoon. Try and keep in the shade.
So what should our listeners do if they were to get themselves sunburnt? Is there anything they can do afterwards if they didn't protect themselves before?
Well, as in everything, prevention is better than cure. So try and use a good protection factor sunscreen. But if you do happen to get caught out, and it is very easy to do, then just rest up, drink lots of fluids, take some simple painkillers such as paracetamol or ibuprofen, and try and cool the skin down with applying soothing sun lotions and calamine lotion, and sponge the skin with cool water. But certainly if you feel unwell with sunburn, or the skin starts to swell or badly blister, then perhaps pop and see your pharmacist, or pop and see one of the nurses in the minor injuries unit, and they will give you further advice.
Was there anything else you'd like to get over to our listeners?
Well, the main worry that we have is the risk of skin cancer. Now, skin cancer is one of the most common cancers in the UK, and is the biggest risk to developing skin cancer is getting burnt by the sun. I'll give you a quick pathology lesson if you like. There are three basic types of skin cancer. One's called a BCC, one's called an SCC, and the most important one is a malignant melanoma. So the BCCs and SCCs are the little skin marks or flaking skin problems around the eyes, top of the ear, on the temple, and on the scalp in bald-headed men. And although technically they are cancers, they are not dangerous in any way. They don't tend to spread. They won't go away, but they do need treatment. The ones that you want to avoid is the malignant melanoma, and that is quite an aggressive cancer which occurs in moles and freckles, and that is the one that you are trying to avoid. People, I think, should be mole aware, so they should report changes in moles, be they getting bigger, getting darker, altering in colour or appearance. If they're ulcerating or bleeding or itching, if you've got a concern about a mole, report it to your doctor.
Well, Adrian, if you're happy, I'd like to thank you very much for taking the time out and talk to our listeners about those areas we've just covered.
Thank you, Daniel.